Welcome back. Today, we're diving into why preventive health often misses the mark for teenagers. While childhood is all about growth and vaccines, and adulthood focuses on screenings and chronic disease, the teen years are frequently treated as a pause, a waiting period where prevention seems optional. Many systems assume teens are resilient simply because they appear healthy, but this overlooks a critical fact. Lifelong health habits are actually being formed during adolescence. When prevention is deprioritized and teens are seen as low risk, we miss a key window to shape future well-being. Let's explore why this gap exists and how it impacts teens' health outcomes. Most teens feel healthy and bounce back quickly from minor issues, so long-term health risks seem abstract or irrelevant. Advice about sleep, nutrition, or mental health often competes with immediate pressures like school stress, social dynamics, and identity development. Without obvious warning signs or immediate feedback, it's hard for teens to feel motivated to act on prevention. This isn't about apathy. Prevention asks teens to care about consequences they can't yet feel. Fast recovery can mask underlying risks, and the long-term effects of habits formed now may not be visible until much later. So, how can we make prevention feel more real and urgent for teens? Common approach to preventive health is simply giving teens information: what to eat, how to sleep, what to avoid, and expecting them to follow through. But knowing isn't the same as doing. The adolescent brain is still developing impulse control and long-term planning skills, so expecting purely rational decisions ignores how teens actually operate. Without supportive structures and routines, information alone rarely leads to lasting change. Effective prevention needs more than just education. It requires environments and systems that make healthy choices easier and more relevant to daily life. Preventive health advice often uses adult language and focuses on distant future risks, which can feel irrelevant to teens living in the present. When messages don't connect to daily experiences, they come across as abstract or even moralizing. Teens may understand the advice but see no reason to act on it. For prevention to work, it needs to match how teens experience time, stress, and identity. Making prevention relatable and actionable in the context of their real lives is key to driving engagement and lasting change. Even when teens want to prioritize preventive care, real-world barriers often get in the way, like transportation, scheduling, and confidentiality concerns. These small obstacles can feel huge, especially for mental health services, which are often hard to access and only offered during crises. This teaches teens that support is only available in emergencies, not as part of everyday life. Early stress and warning signs are often overlooked, and essential coping skills aren't taught until it's too late. Prevention should be about building resilience and support before problems escalate. Behavior doesn't happen in a vacuum. Schools may reward overwork, social media encourages comparison, and food environments often make unhealthy choices the default. When systems ignore these pressures, asking teens to make healthy choices becomes unrealistic. The context around teens is just as important as the information they receive. For prevention to succeed, we need to address the environments that shape daily decisions and make healthy options the easy, supported choice. Truly support teen health, prevention must be woven into daily routines, schools, and trusted relationships. Healthcare systems need models designed specifically for teens, focusing on ongoing support rather than one-time warnings. Access should be simple, confidential, and flexible, making prevention a normal part of life. When systems provide structure and relevance, teens are more likely to build healthy habits that last into adulthood. Prevention is most effective when it focuses on building skills, not just issuing warnings. Teens need practical tools to manage stress, make decisions under pressure, and recognize early warning signs in both physical and mental health. When prevention emphasizes capability and agency, teens feel empowered to take charge of their well-being. Confidence, not compliance, is what helps healthy habits stick for the long run. Habits formed during adolescence often last a lifetime. Sleep routines, coping strategies, and health attitudes stabilize in these years, setting the stage for adult well-being. When prevention fails in the teen years, the result is decades of avoidable health issues and higher social costs. Investing in early prevention pays off by reducing future burdens and helping teens build a strong foundation for healthy adulthood. Summary: preventive health often fails teens not because they don't care, but because systems are misaligned with how adolescents think and live. Information without relevance, access without ease, and advice without structure don't lead to action. By treating adolescence as a foundation for lifelong health, rather than a waiting period, we can change outcomes for the better. Healthy adulthood starts in the teen years. Let's make sure our systems support that journey.